This film is intended for eye surgeons for training and education purposes. Viewer discretion is strongly recommended.
Soft cataracts can be hard. Hi, this is Dr. Deepak Megur. Today we'll discuss about soft cataracts, which many of the beginner surgeons find it intimidating. This presentation is primarily aimed at the younger surgeons who usually prefer to do the soft cataracts in their learning curve but find it challenging in a few of them. However, the experienced surgeons have a way to deal with them and they somehow manage to come out of these difficulties. Now, since the younger surgeons do find it tough, I'm aiming this presentation for them. To begin with, it's important for us to realize that all soft cataracts are not the same. The most common misconception is that all soft cataracts are the same and the same technique is going to work for every type of soft cataract. So it doesn't. So let me explain. For example, the soft cataracts in the young, they're much more easier to manage. The nucleus in these lenses are gummy and they can come out in a single piece out of the bag and that can be easily aspirated out. So it's relatively easier to manage them. On the contrary, soft cataracts in a 50 or a 60-year-old man can be tricky. For example, few of these cataracts in this age group can be purely cortical. They wouldn't be having any nuclear sclerosis. Another challenging variant is the diabetics in the same age group of 50 to 60 and who have this cortical cataracts. These are the classical crumbly cataracts and such type of cases really challenge the patience and the skill levels of the beginner surgeon. So what difficulties do we have while dealing with these crumbly cataracts? The problem really is that since we are unable to hold them, we cannot chop them, we cannot laterally separate them, and eventually we end up having a bowl which can be really intimidating for the novice surgeon. So before I start the case series, two important universal thumb rules when dealing with softer cataracts, especially for the beginner surgeons. Number one, have a bigger excess, and number two, have good hydrodissection. If the novice surgeon has followed these two golden principles, if ever they encounter a sticky situation with a soft cataract, they would somehow manage to come out of it. But the problem is, many times you don't anticipate a difficult soft cataracts and you've done a excess of a normal size and then you go in and try to chop. Then you realize that, okay, this is going to be tough. So let's begin the case series and let me remind you that all soft cataracts are not the same. Case number one. Now this patient is a 45-year-old gentleman who has a nucleus of about grade 1 or grade 2 and you can see that the rhexis is not the ideal size for a soft cataract. This is about 4.5 millimeter, 5 millimeter, but I am not expecting any difficulty in this situation. I do a hydrodissection, I do a hydrodelineation, I have a classical golden ring present. So what the hydrodelineation basically does is it reduces the overall diameter of the nucleus. Now once the diameter of the nucleus is reduced, it's easier for us to flip it out of the bag in toto and then emulsify or aspirate it in the anterior chamber. In this case, I'm going to demonstrate the carousel technique. The setting which I'm going to use is the high vacuum and high flow rate, but the power is very low. It is about 5%, something what we use in the epinucleus mode. So I begin by aspirating the epinucleus beyond the golden ring, and as the epinucleus beyond the golden ring is being aspirated out, we can then catch hold of the nuclear edge and literally wheel it out of the bag, and then it can be aspirated in toto in the antechamber. So as was demonstrated in this case, if you want to use a carousel technique, it's helpful to do an hydrodelineation. By that, we're going to reduce the overall diameter and the nuclear mass, and it could be easily flipped out of the bag and then aspirated. Now, this is the next case. This is a 30-year-old lady. Again, I would like to draw your attention to the rhexis size. It is, again, not large. It's about 4.5 or 5 millimeter. I was not anticipating any difficult nucleus management in this case because the patient was young. So hydrodissection is done. What I'm doing now is just nibbling at the junction between the epinucleus and the nucleus using only vacuum. What essentially is being done is the overall mass of the nucleus is being reduced, and eventually the mass is reduced to such a stage that the remaining half of the nuclear mass can easily be flipped out of the bag and then emulsified. So if we look back at two cases, the basic principle which we followed was to reduce the size of the endonucleus and then flip it out of the bag and then aspirate it. Well, this is a very easy technique to follow, but the prerequisite condition is that the nucleus has to be thin, has to be smaller in diameter. Then it becomes much more easier for us to flip it out of the bag and then aspirate it, which was possible in both these two cases simply because the patients were young and the nucleus was soft, thin and small. Let me take you through more difficult case scenarios. He's a 60-year-old man who has this cataract, and rhexis is done, hydrodissection is performed, it looks to be alright. The capsular bag is decompressed by pushing down on the nucleus, the fluid is let out. So far so good, I'm not expecting any difficulty in this case. As I try to bury my phaco tip into the substance of the nucleus, we can see that there is absolutely no hold on the nucleus. I'm unable to hold it and chop. So I realized this and quickly changed my strategy. Now I'm going to do something like a stop and chop technique. I want to do a trench. So I'm just creating a deep trench. And once I feel it's appropriate depth, I try to do a lateral separation. And here I cannot crack the nucleus into two halves. So I'm in a situation where I can't chop the nucleus and I can't do lateral separation. So in such a situation, I revert back to our old technique, that is the chip and flip technique. The principle which you're going to use is the same. You're trying to reduce the overall diameter of the nucleus so that the resistance faced by the rhexis is done with, and then we can hold one of the anterior leaflets of the nucleus and then flip it out of the bag and then emulsify. But we encounter difficulties to hold the nucleus and pull it out of the bag simply because the nucleus would be just crumbling and we're unable to get a hold. In such a situation, we need to use as little power as possible, adjust the vacuum so that we engage the part of the nucleus, get a hold on it and then flip it out of the bag. Now, the one setting which we need to reduce is the power. A reminder for the people who are using Alcon machines is that we've got two options there, to use a torsional energy or the longitudinal energy. When we want a very low power to be given, then it's always better to switch to the longitudinal mode of the energy delivery, which has got less cutting efficiency but better holding efficiency. So you can use very low longitudinal power to just engage the one leaflet of the antinucleus and then hold it and then pull it out. So the bottom line is, choose the least power which is available in your machine and then use it to engage the soft nucleus and then pull it out. But for the people who are using other machines like Oertli and Johnson & Johnson, the only thing one has to do is reduce the power to its lowest setting. Moving on, this is the next case. This patient is around 60 years old, diabetic. I've attempted a chop, it doesn't work. The problem in these cases is we don't have epinucleus. In the sense, we just can't get the hydrodelineation done in such situations because essentially there is no endonucleus. There's one entire mass. It's like a cortical cataract. And we can't get the hydrodelineation right because there's essentially no differentiation between the epi and the endonucleus. So let's understand the basic difficulty here. We have a rhexis which is relatively small and it's going to obstruct the relatively large nuclear mass, which we are unable to reduce the size because we can't get the hydrodelineation done in this case. So one trick to try in such situations is at least try to divide the nucleus into two halves. So our hope is that we'll be able to pull at least one half out of the bag and then things would then be subsequently easier. My goal is to create a long, thin trench and then try to crack this into two halves. So essentially I'm trying the stop and chop technique. So thankfully in this case I could get the division right, and now I have an option of subdividing this heminucleus into three halves, which we typically do. But in this case, because the nucleus is relatively soft, I'm just dividing into two halves. Mind you, when you're doing this chopping maneuver, you're hardly using any phaco power, just enough to engage the nucleus at the lowest power setting, build the vacuum, chop and then do it. We have just divided each heminucleus into two halves and then emulsified these smaller fragments. In few cases, you need not divide them into these four quadrants as well. You can just divide them into two heminucleus and then pull each heminucleus out of the bag. Now, lastly, coming to a new technique which I am practicing of late, this is what I call as a double Y groove technique. It's essentially similar to the stop and chop technique. Only modification which you're doing is the shape of the trench which you created is in the shape of a Y. That is, it is wider at both the ends, resembling a double Y. So let's understand what advantage this gives. Now, assuming that we have done a regular long thin trench and now we're trying to pull one of the heminucleus out of the bag. Since the two heminuclei are snugly fitting against each other, we sometimes find it difficult to engage one of the epinucleus and pull it out because of two resistance which we face. One is the resistance of the overlying rhexis, that is universal. The second resistance is of the adjacent opposite heminucleus. Because in trying to engage this, the adjacent heminucleus itself provides resistance, and hence we are unable to pull this heminucleus out of the bag easily. So to compensate for that, what we're trying to do here is we're going to widen the trench in the peripheral part. So by doing this, we are trying to minimize the resistance faced by the opposite adjacent heminucleus. So let me take you through this case. I'm unable to chop the nucleus. It's a crumbly nucleus. I don't have the epinucleus shell so that I can reduce the size of the nucleus and then flip it out. So I'm resorting to the stop and chop technique, although with a slight modification. So I'm creating a long, thin trench. What additional thing I'm doing here is the peripheral part of the nucleus is sculpted wider compared to the central narrow trench. So we have a slightly wider peripheral edge of the trench compared to the central sculpt. Same thing is repeated on the opposite quadrant as well. So essentially we have a central thin trench, whereas the peripheral trench is slightly wider. This resembles the alphabet Y. The two heminuclei are separated, and you're trying to pull each of the heminuclei out. There is again one small trick. Now where do we engage this heminucleus for us to easily pull it out? So if you hold it near the center of the heminucleus like this, it's quite difficult to pull the nucleus out simply because the amount of the nucleus which has to face the resistance of the rhexis is large. On the contrary, if we engage the nucleus in its more peripheral part, it's much more easier to pull it out simply because a lesser amount of nucleus faces the resistance of the overlying rhexis. So instead of holding at the central or the paracentral area, we are better off at holding at the near the peripheral edge of the epinucleus, again using as little power as possible, only with vacuum, and then you can clearly see that it's much more easier to flip the heminucleus out of the bag. Essentially the trick is to pull out one pole of the heminucleus out of the bag. And to pull out one pole of the heminucleus, it's always easier if we can hold it at the mid-periphery or peripheral part rather than the central or the paracentral region. By following these principles, it's easier for us to prolapse the heminucleus out of the bag in a much easier way and then subsequently emulsify it in the antechamber. So to summarize, all soft cataracts are not the same. So we need to use different techniques to deal with the different variants of the soft cataracts. But as a general thumb rule, if you have a bigger rhexis and a good hydrodissection done, most often than not, it won't be so difficult to manage these soft cataracts. Thank you so much for your attention and hope you found this helpful.